In this lesson, we will study Chapter 17, Congenital Malformations, Deformations, and Chromosomal Abnormalities, covering code range Q00 through QA1. This chapter applies to conditions present at birth and is tested frequently on CPC and CCS certification examinations. This lesson is for educational purposes only. Please refer to official ICD-10-CM guidelines. Learning objectives. By the end of this lesson, you will be able to correctly assign Chapter 17 codes, determine when congenital conditions may be principal or secondary diagnoses, identify when manifestations should or should not be coded separately, apply lifetime use rules, correctly sequence congenital anomaly codes with Z38, and avoid common CPC examination errors. Chapter 17 Exam Importance. Chapter 17 is frequently tested on CPC and CCS examinations, often in combination with newborn and perinatal coding scenarios. The most common exam errors involve overcoding manifestations and incorrect sequencing with Z38. A strong understanding of inherent versus non-inherent conditions is essential. When to assign Chapter 17 codes. Assign a code from categories Q00 through QA1 whenever a provider documents a congenital malformation, congenital deformation, or chromosomal abnormality. These codes may be assigned as either a principal diagnosis or a secondary diagnosis, depending on the reason for the encounter. Principal versus secondary diagnosis. A congenital condition may be reported as the principal diagnosis if it is the primary reason for care. It may also be reported as a secondary diagnosis when it coexists with another condition that prompted the encounter. Sequencing must always reflect the clinical circumstances. Manifestations with congenital conditions. When a congenital condition does not have a single unique ICD-10-CM code, additional codes may be assigned to identify associated manifestations. However, manifestations that are an inherent component of the congenital anomaly must not be coded separately. Inherent versus non-inherent manifestations. An inherent manifestation is a condition that is normally part of the congenital anomaly and is not coded separately. A non-inherent manifestation is not typically associated with the anomaly and should be coded separately. This distinction is a high-frequency CPC exam topic. Lifetime use of Chapter 17 codes. Codes from Chapter the 17th of may be used throughout the life of the patient. Congenital conditions do not expire with age. There is no age limitation for assigning Q codes if the condition is still present. Late identification of congenital conditions. Although congenital conditions are present at birth, they may not be identified until later in life. Whenever the provider diagnoses a congenital condition, it is appropriate to assign the corresponding Chapter 17 code, regardless of the patient's age. Corrected malformations. If a congenital malformation or deformation has been fully corrected and is no longer present, an active Q code should not be assigned. Coding should reflect current clinical status. Personal history codes. For fully corrected congenital conditions, assign an appropriate personal history code. This documents the historical condition without implying an active disease process. Congenital conditions at birth. For the birth admission, a code from category Z38, identifying live-born infants according to place of birth and type of delivery, must be sequenced as the principal diagnosis. Z38 with congenital anomalies, voiceover. When congenital anomalies are identified at birth, Z38 is sequenced first, followed by the appropriate Q00 QA1 codes as secondary diagnoses. This sequencing rule is absolute and heavily tested on exams. Important Z38 reminders. Remember that Z38 is assigned only once, is used only on the newborn record, is never assigned on the maternal record, and is not reused if the newborn is transferred to another facility. Common CPC exam errors. Common examination errors include coding inherent manifestations separately, assigning Q codes on maternal records, forgetting that congenital codes are valid for life, missing Z38 sequencing, and assigning active Q codes for corrected anomalies. Quick exam recall. To summarize, Q00 through QA1 codes represent congenital conditions. They may be principal or secondary diagnoses. Inherent manifestations are not coded separately. Corrected conditions require history codes. And Z38 is always the principal diagnosis on the birth record. Lesson 19 Summary. In this lesson, we reviewed congenital anomaly coding rules, manifestation guidelines, lifetime validity of Chapter 17 codes, corrected conditions, and newborn sequencing requirements. Mastery of these rules is essential for accurate ICD-10-CM coding and CPC exam success.